Okay, you guys, so doing another live Q&A for you. Hopefully there's enough lighting. I'm just here on my ThinkPad. So I just ended my day in clinic where I was doing treatments and seeing my patients, which I love doing. You can see I have my lasers in the background. Hopefully I turn them off so they're not too loud, but I just want to be able to be available for you to answer any questions that you guys have. And I think it's important to do live Q&As because it's my way to engage with you guys and answer any questions that you guys have and see what you're thinking and what you're wanting to hear about, or any questions that you have, because any questions that you may have may be similar to questions that other people are having. So if you're not able to attend this live, I will go ahead and post it so that you can watch it later. And I'm sorry that it's so spontaneous. I kind of figured out with my day in clinic that I would be able to do this live around 2:30 Pacific Standard Time. So I did post on my YouTube channel that we would be doing this live earlier today. So hopefully you got that notification. But if you're not subscribed, be sure to subscribe and hit the notification bell so that you get the notifications when I do a live, so that you guys can answer anything and ask me any questions that you guys have. So I'm here for you now. Hi, it's so good to see you guys. It's so cute. And so any questions that come up, I'll be sure to answer them in real time. So hopefully this works out with your schedule. I know in the past couple lives that I do one every week. I was doing it on Tuesday mornings. This morning I had a meeting, so I couldn't do it this morning, but I'm just finished clinic and I'm about to go pick up my kids from school in about 30 minutes. I have a timer set on my phone, so I'll be able to answer your questions in real time. So if you guys have any questions, be sure to type them in so I can see you and I can answer any questions that you guys have. But hopefully, I don't know if you guys have been using the MDR products, but if you have and you love them or you have any feedback, I know I've been seeing patients all day who've been using the products who are loving them and they're having amazing changes in their skin. And again, this is just something that I formulated for you guys. It's from the heart. It's just from 20 to 30 years of studying the skin and understanding exactly what the skin needs, and the technology and innovation that the skincare market right now is really lacking. So hopefully, you guys will have been able to try it by now. And if not, hopefully, if you do sooner or later, you'll be able to see what I mean. And everybody's loving it. So I hope you guys are loving it too. So good to see you guys. I'm so glad that you guys are able to try them. So somebody is saying, loving the MDR products. Can vitamin C cause breakouts? So that's actually a great question. Not usually. Vitamin C formulations, sometimes containing oil, can cause breakouts. But I have a few patients who I have in my practice who weren't able to tolerate vitamin C formulations, but they're able to tolerate mine, which is really reassuring. And that's why I engineered it in such a way to where it's clean. There's no oil. The vehicle delivery systems are next level, and the innovative technology allows it to have the effect of a vitamin C. And the most potent anti-aging vitamin C formulation is the L-ascorbic acid vitamin C molecule. So that's the most important one. A lot of other skincare lines will have THD or the other forms of vitamin C, which I have it in mine as well, but the most powerful one is the L-ascorbic acid. So that's always a vitamin C that you want to look for in a product. And it's engineered in such a way that it should not clog pores, shouldn't cause breakouts. There's no oil, there's no additives in it. And so I have 3 or 4 patients who can tolerate vitamin C because of acne breakouts or irritation, and they're able to tolerate my vitamin C just fine. So hopefully that won't be an issue for you. Hi, you guys. Good to see you. Okay. Hello. I have your eye cream and love it. Do you have growth factors and other products? And if not, do you use them? So I actually don't have any growth factors in my products. And the reason why is because I have peptides. So growth factors are peptides. Growth factors are naturally occurring peptides, and engineered growth factors or peptides in the lab can have the same effects without some of the potential harmful effects of growth factors. So again, I have to be careful what I say because I don't want to say anything negative about growth factors, but as a skin cancer surgeon, it's hard for me to put human-derived growth factors in skincare products because, I think when they are engineered smartly and effectively in the form of peptides or polypeptides, without the risk that sometimes growth factors can have, with perpetuating possible tumorigenesis or things like that. I just, as a skin cancer surgeon, I'm opposed to human-derived growth factors at this point in time. And polypeptides and anti-aging peptides pretty much do the same thing as growth factors do, but they don't carry a potential risk that sometimes even plant-based growth factors can have. That's just me. That's just the way I've been trained. And I look at the skin differently, especially as a skin cancer surgeon. So my products don't have growth factors in them, and they have anti-aging peptides and polypeptides, which I feel, in my opinion, in 2022 is much smarter, much more efficacious, way lower risk side effect profile, and more smartly engineered. So growth factors are important because they're signaling messengers that cells relay to each other. For example, growth factors or interleukins, cytokines, chemokines, these are basically cellular messengers that how cells talk to one another. So in a wound healing environment, for example, say that there's injury to the skin. Now the injury could be a burn, it could be a laser, it could be, a naturally occurring injury that happens in the skin. The way your skin cells communicate with one another is, hey, increase collagen, increase elastin, let's get some immunomacrophages in here to clean up the area. We need to have some fibronectin. And that's how cells talk to one another. So skincare industry and skincare companies will harvest those intracellular messengers and put them into serums and eye serums and face serums to have your cells do just that, stimulate collagen, stimulate elastin. But I remember attending a lecture where you have to be careful with growth factors, because if you give too much of one, you can ramp up cellular activity, and you don't want to rev up cells too much, because then you could have a potential for tumorigenesis. So I feel as a provider and as a dermatologist that polypeptides are a little bit more my cup of tea. I've been using growth factors on my skin though for a long time. I used to use TNS essential serum, but that also is growth factors that are derived from penile foreskin, human derived. So I have a little bit of a mental issue with putting that on my face. And then the plant-based growth factors from CO Skin Health, which I love a lot, are great too. But when I engineered my own, I just wanted to be more forward thinking and advanced and have just more advanced peptides instead of growth factors in my skincare line. But again, that's not to say anything negative about growth factors. If you're over the age of 30 and you're using growth factors, that's great. But polypeptides and anti-aging peptides are just as effective. They're smarter versions of naturally occurring growth factors, in my opinion, without the deleterious effect of possible tumorigenesis. So hopefully that makes sense. Okay, what is the best skincare product? Oh gosh, I just skipped 20 questions. Okay, what is the best skincare product for very sensitive, dry skin? So out of my line, the MD Air line, I would say the NMF Hydrator, definitely, because it has barrier repair. It helps reinforce the skin barrier, and it helps minimize transepidermal water loss. And your skin barrier, which it's just in the epidermis, basically protects the skin from the external environment. So that could be allergens, it could be toxins, it could be microbes, fungus, yeast, virus, particles, allergens that can get into the skin and cause sensitization. So you want to reinforce that barrier. And my NMF Hydrator has that barrier repair, has DNA repair, has other things too, but that's probably the best formulation for sensitive skin. And it's great for just soothing and hydrating the skin, as well as for powerful anti-aging effects because of the peptides in it as well. Okay, so hi, Dr. Keppel. What brand do you like? Do you think that they're all beneficial for improving skin health? Thank you for all you do. There's a lot of great skincare lines out there. And of course, I'm more of a medical grade proponent. I recommend medical grade skincare products for my patients just because it's smarter technology, and, everything that you put on your face or, your skin should be working for you. So when you put it on at bed at night, your skincare product should be working for you. When you put them on in the morning, as you go about your day, you're working, you're with your kids, it should be working for you. So anything else that doesn't have that, you're missing an opportunity. So the skincare lines that I really stand behind are the ones that really have legitimate research and effective randomized control studies and data showing that they do what they do. And if they don't, if they're a smaller company, patients who, and I've been doing this for a very long time, and I see patients, hundreds of patients each week in my office,